Ready?
Yes, ready.
3, 2, 1.
Oh. Can you make this? Wait a minute.
Okay, on air.
Can you make this full screen, please?
Okay.
Can you make this full screen, please?
Yes.
Thank you.
F5.
F-Y?
F5.
F5. F5. Okay. All right, done.
Okay.
All right.
Hi, my name is Madam Chan,
And hi, my name is Madam Elaine.
and we are nutritionists and wellness coaches at Scientist Homes.
Yes. And today we're going to talk about obesity and severe fatty liver.
Yes. So,
Do you think that this is pretty common in Hong Kong or rest of the world?
as a
As in the obesity?
is it a health issue?
Oh yes, it is. Like most people don't even understand that this is a health issue. So this is one of the global public health crises if you see the facts and figures in the world. Yeah.
So, what are the complications that leads with obesity?
Actually, there are first we're going to talk about how many people are suffering from this health issue.
How many people are there actually?
Actually, there are 890 million people are suffering
Worldwide?
from worldwide. So it's like 1 in every 8 people are suffering from
So
it.
just your neighbor.
Yeah, it's
casually
like 1 in
walking
every
down the street is
and every other
suffering?
person you see is like having this health issue.
Oh wow!
Yeah,
I see.
it's a lot.
I see.
Yeah. Then how do you know that this that there you are having an obesity? How do you really come to know?
How would you come? I think definitely shortness of breath.
Yes, shortness of breath.
Yes.
Right.
And also, I think definitely fat
Around
accumulating around
different areas of the body. Yeah.
I mean, physically. I mean, internally you can't see, but I mean, physically, arms.
And
Maybe the waist,
Yeah,
but I
maybe the
think
waist.
there's definitely medical terms for the different types of obesity.
Yes, definitely. But the problem is, some people don't look obese, but internally they are, and it's because of they're accumulating fat around their organs, and this is hampering their health. So it doesn't have to some people don't physically see obese, So that's one of the reasons people don't understand that obesity is a health issue.
What kind of organs does it affect?
Like all organs. It could be your heart, it could be your liver, it could be your intestines. So it generally spreads all around your body. Yeah. Do you think there are different types of obesity?
Definitely.
Yeah.
I know that there is definitely central obesity, which is around the tummy, which I think most people have.
Yeah,
And
true.
is it the same with the around the thighs and the bum and?
Yeah.
Or
Because-
is that peripheral?
No,
obesity?
that's because if you generally categorize, generally categorize the obesity, so it's like mild, moderate, and severe. But if you look into along the distribution of fat in the body, so you see it around the waist, a lot of people, and have around the hips and around the thighs, right? And also especially at the back of the shoulders, you see a hump. People have it. So it's because they are accumulating fat around those areas. So that's more like a central obesity. And then some people have it around their arms and legs. So generally
that would be peripheral.
that would be peripheral. That would be the peripheral
So
obesity.
would peripheral obesity be less serious than central obesity, or would it be similarly as dangerous?
Actually, the obesity is obesity, whether it be that the central or peripheral, because both of them have their own comorbidities associated. So it's like, if people have like more central around the waist, they are more prone to have diabetes, high blood sugars, and they're more prone to have liver issues, liver fibrosis, or things like that, or maybe intestinal issues. And those who have like around their arms, they have like
Maybe
more.
explain the word fibrosis to the audience. I think it's quite a technical term.
Oh, yes, it is. Actually, fibrosis is a process where when the inflammation starts in any of the organ, different cytokines come into place, and that area is actually becomes protected by different proteins from the body, and it's a protective mechanism around the body as well. But body cannot excrete it, so it protects you from that damaged area by a process called inflammation, and then the fibrosis starts inside that area because of the accumulation of different amino acids and things like that. Lots of collagen and enzymes, start to add up into that area. So I'll definitely speak about it in detail once we go further, how the mechanism of the disease progresses. Yeah.
So what are the stages of obesity?
Oh, there are different stages actually. If you see, like here, we have this picture. This is very visible. That usually the normal weight lies between,
So the numbers above are the BMI.
Yes, these are the BMIs. So this is the general criteria to see, how your height and body weight correlates, and this changes, if you have a different gender, like a male and female, and your age as well. So it depends on these factors. So these are the general ranges when you see that, people have, if you lie into the BMI category of a normal weight or an overweight, and then if it further exceeds, it's grade 1, grade 2, the higher the grade, the greater the obesity is. Yeah. And it's actually terrifying to see, some people, they don't even have much, they don't even have the higher grade, but they are still, suffering from a lot of health issues because of the mechanisms that are going inside the body. Yeah. And what do you think, Madam Chan, that what are the risk factors that lead people to this issue?
That what factors lead to obesity? I would think the lack of exercise.
Yeah,
and also I think unhealthy diets.
Unhealthy diets, yeah, that's like the first preliminary thing, because people, some people, they have a very active lifestyle. They go for a walk, they go to gym, they don't live a sedentary life, but their eating habits are pretty bad, eating up on junk foods, eating up on fried foods, having not a proper ratio of carbohydrates, fats, and proteins into their diet. So this leads to an imbalance of, the nutrients in the body. So do you think that high calorie intake is one of the risk factors?
Yes, definitely, for sure. I think because we don't, I think as a race, or maybe Hong Kong in particular, because we all work at a desktop job.
Yeah, majority of the people do
Yeah,
that.
and then we consume more calories than we output.
Yeah.
So that leads to weight gain.
Yeah, true. Actually, there's a circadian rhythm of the body, like where you wake up at certain time, and then you have breakfast at certain time, and then subsequently the lunch and the dinner. So because of the work, the work habits we have, not only in Hong Kong, even in, like, when I was working as a doctor back in Pakistan and Saudi Arabia, people are stick to their chairs, and they're working for long hours. They cannot, have much walk, and they're forced to do that because it's a lifestyle. It has become a lifestyle. So they're consuming more and more calories, because if there is like a long gap between two meals, so definitely you're gonna overeat in one time, and once you're overeating, you forget that you're having more carbohydrates than more proteins, right? So this is one of the factors.
And I think definitely women are easier to gain weight than men.
That's true. That's true in one
Yeah.
sense, but because of the childbirth factor, you're a
Yes.
mom yourself, you know this.
Yes.
Yeah, that once you get pregnant, you're definitely more prone to get weight. But you shed
And
that
is it-
easily as well.
But does the hormone changes in your body because of childbirth, does that affect?
Exactly.
Yeah, that
That's-
affects.
Yes, that's not a myth. That's true because of the hormonal changes. But once the the female gets is done with the delivery, the hormones, they start to shift back to the normal ranges again. And once they are normally into the ranges, the body sheds its weight itself. But definitely you have to work harder than pre-pregnancy. You have been into this, so you know
Yes,
this.
yes.
Yeah. But men are no less. They're into the same category as well, because of the junk foods these days. Readily available fast foods, the oily fried chickens and burgers and pizzas. I'm not like tagging them like they're bad food, but everything in moderation is like
Yes.
is the key. Moderation is the
Yes,
key.
yes.
Even if you're drinking or-
Everything good, even good food in excess can be bad.
Yes, everything in excess is bad. Limitations. There should be a limitation to things. Even if you're drinking, you're having a fizzy drinks or maybe alcohol, moderation is the key. Yeah. Do you think that poor sleep is one of the factors?
I don't know actually. I've heard that, but I wasn't sure if it was a myth or not.
It is. It's not a myth. It's true. It's
How
pretty
does
true.
bad sleep affect your weight?
Because I just talked about the circadian rhythm, that's the, just like there's
Your
a
body clock.
Yeah, it's a body clock. Just
Yeah.
like the world have a clock, the body has an internal clock. So once that gets disrupted, you're waking up with the sun. Our ancestors, they had this habit of waking up with the sun and then sleeping with the sun. That was actually really good. One of the best habits they had, because it puts your circadian rhythm into its normal working process. So once you wake up early, your hormones, your stress hormone, it's in the highest level in the morning. And then if you're sleeping at that time, that's not good for the heart. It puts your heart in stress, and once your heart is in stress, your arteries and subsequent organs goes into stress as well. So the body needs a repair system, right? And once you're into the sleep state, and especially the deep state, that's the time when the body goes into the repair mode. And once
I
your
see,
repair
I see.
mode is disrupted, that's a havoc. Yeah, and body don't know, how to deal with that havoc situation.
Yes.
And the easiest way is to store everything into a fat.
Oh, I see.
Yeah.
And then that's how fat is accumulated
Yeah.
because of bad sleep.
Yeah, that's how it goes.
I
into
get it,
that.
okay.
Yeah.
And next we have the risk factors. So we should have a diagram.
Oh yes, we have a diagram to show you, that how your lifestyle, your socio-economic factors. Do you know how socio-economic factors affect?
I think is it stress?
Yeah, it's your actually access to
Bad food.
bad food. Yeah, unhealthy food. I would say. I
Because
would.
unhealthy food is definitely cheaper
Yeah, it's cheaper
than organic.
Yeah. I'm not saying that you know, it's obviously it's better to get an organic one, but you know, having the ratio of proteins, carbons, and fat, that's one of the key factors that, you know, the maximum portion should be the protein, and the maximum portion, the least portion should be the carbohydrates.
Yes.
And then the types of carbohydrates matter too, you know.
yes.
Yeah.
So
yeah.
what are the good carbohydrates?
The good ones are the ones that you see naturally, like in a fruit, you know. You see the fruit,
Like bananas?
like bananas, apples. You have that's the natural. Nature has given you everything in a balance. The fiber it has, the carb, the type of fructose it has. It's amazing for your body. But if you make a juice out of it, you take away the fiber, you know, and whatever you're consuming is like pure carbohydrates. So once you're consuming pure carbohydrates, your sugar is going to spike into your blood, and that's a whole mechanism, you know. The sugar spikes, the inflammatory markers spikes, and then your the whole system is disrupted.
I see.
Yeah.
So
And do you know that snoring also contributes to obesity?
how so?
Because when you're sleeping, the oxygen to your brain and your organs is not going smoothly, because your snoring is basically is an obstruction while you're sleeping, while you're breathing, you know. That's an obstruction. So oxygen, when the oxygen is not going properly to your heart and brain, that leads to so many complications.
Oh, I see.
Yeah, and the body doesn't know how to deal with it. So the only thing is, it's going to take it as a stress. And once the cortisol, and stress is like, once your body goes into the stress, your cortisol hormones increases in the body. And cortisol, it means it's going to store everything into fat.
I see.
Yeah.
So let's talk about the impact on health. Obesity and the impact of health. Maybe you can pull up the diagram.
Yep, I have. So it's like, this is a very complex picture, but don't get
But
scared.
as you can just see, it affects everything.
Yes, it affects everything. This is just a general view to, you know, that it's not only affecting your brain, your heart, your liver, your intestines, your digestive system, your immunity system. That's one of the major like protective mechanism in your body. And you know, it's like having a whole full force in your body, and once your full force is not there, you're being attacked so many pathogens.
I see.
Yeah, even your reproductive health is affected, you know.
How so?
Because the body is going into stress. Storing fat is like having a stress on the body. So if your cortisol hormone is high, definitely your body hormone system will disrupt. And especially for men, it's very difficult, because they have, like, you know, most of the men, they have erectile dysfunction.
Oh wow.
Yeah.
Okay.
Yeah, it affects their fertility, it affects their love life. Yeah, and people don't even realize that it's because of the obesity.
Oh.
Yeah, and in women, they are unable to conceive children. The sperm quality is affected. The sperm motility is affected. And then once that happens, the egg quality decreases. Right? And then the hormone imbalance happens, the PCOS, the polycystic ovarian diseases, these kind
So
of,
can
you know,
fat also, you know,
accumulates
accumulate
around
around the ovaries?
the ovaries, and it's difficult for the ovaries to ovulate and release the egg.
Oh,
And
I
even if it does
see.
so, the quality of the egg is reduced.
Oh, okay. Oh,
Yeah,
I
yeah.
see, I
So
see.
this is like it's like a seed. You plant a seed. Obesity is like a seed. If you plant it and then it starts to, have its root and form into a tree of different diseases.
Oh, wow.
Yeah, so it shouldn't be taken so lightly. It's very important to understand, that this is one of the biggest factors.
So, let's discuss sign and symptoms of obesity.
Oh, yes.
So, let's say if it was any other disease, there would definitely be severe signs of back. If it was something wrong with your back, it would be back pain. It would be, a lot of different things. But what about obesity? Is there pain?
Actually, that's the dilemma, people don't feel pain, that they don't even realize that they're becoming obese, or they might just say that, oh, I've gained a little weight, maybe a pound or two, maybe 5 kgs or something. But they don't understand that, the complications, they are, accumulating into their body. So it could be, it starts from the fact that it becomes difficult for normal activities to do, like taking a flight of steps, or maybe changing your clothes. You feel a little shortness of breath.
So I have a model of the joints here. Could you show me which part would be in distress?
Yes, once you gain the fat in your body, it has a stress on the body, right? Not only on your bones, but also for your joints as well. Because as you can see in the screen, that these joints put pressure, so much pressure. As you gain weight, it pushes the two bones together, and the cartilages in between those bones get pressed. So once anybody walks with a higher, people say, oh, if I'm gaining weight, why am I having pain around the joint? Everything is linked. Yeah, so it's like, it's like if sometimes people, they say that, they're tired, or they're just having a little bit of back pain. Some people even, they say that, maybe it's because I keep sitting for longer hours at work, that's why I'm having back pain. Or maybe they start having pain around their neck because they're using their phones a lot. They're like, hunching their back and looking at this. Obviously the posture matters, but gaining weight is a stress on the bones of not only the cervical bones, but also the thoracic and the lumbar bones, the spine of the back, so it's putting pressure on everything. So ultimately, people start having a different postures, like, having a very low back posture, or not sitting upright. So everything just adds up to it. And it psychologically affects people as well.
How so?
You can't, you don't feel confident enough to do your daily activities.
Oh, I get it.
Especially for ladies,
I remember breaking my arm, and then having people to do things for me, like feed me and dress me and help me shower. It's very I want to say degrading.
Yeah.
But I don't want it to sound so serious, but I get that feeling where you feel so helpless because mentally you're able to do it all.
Yeah, exactly.
But just physically because of the weight issue and
because you that was a different case, but a similar one, because you were dependent on people. So
yes.
Once people are like morbidly, they start having like, low self-esteem. Yeah. So this is a thing, for us ladies, that and this is something prevalent in men as well. Nowadays, men want to look good as well.
Yeah.
Yeah, having those skinny jeans and those shirts.
Yeah, for sure.
Yeah. So like I'm just showing you this on the PowerPoint, that these
symptoms?
are just the signs and symptoms.
Yes.
Yeah, the joint pains, low self-esteem, like snoring, just we discussed before, right? This is one of the risk factors that leads to it. Okay. So how do you diagnose, Madam Chan?
I think first is a physical examination,
Mm-hmm.
and then you would look at your medical history,
Yeah.
and then I think waist measurement would be vital for diagnosis.
Yeah. Yeah. Yeah.
And then if there are other complications or there are other signs and symptoms, then I think a full blood test would be good
Yeah. Yeah.
to have a clear indication of what kind of obesity you have, or if there's more than just obesity,
Yeah.
which will be in our
The interesting case that
interesting case study that we'll talk about later.
we're gonna talk about today. Actually,
So
we're going
stay
to show you.
tuned,
Stay
stay
tuned. Yeah. So, do you know what? Actually, this waist circumference measurement is one of the very critical factor in diagnosing the obesity, because for those people who have central obesity, they don't even realize that they're gaining fat around their circumference, like their waist. And this waist to hip ratio is the new diagnostic criteria for knowing whether you are obese or not. Obviously, in our clinical settings, we use body mass index as a general factor to diagnose, but the waist to hip ratio is like the most updated standard by the WHO to diagnose the obesity. And obviously, just like you said, that blood tests are one of the things that we nowadays see most people do to see if you have high cholesterol or if you have other inflammatory markers going on in your blood. We're definitely going to talk it in detail now. Yeah. Do you think that this obesity thing is linked to having more alcohol or eating more junk food or fructose kind of things?
Definitely. I know there are definitely two types of fatty liver. There is the alcoholic fatty liver, and then there's the non-alcoholic fatty liver.
Yeah. Yeah. So those people who don't even drink, but they still can have a fatty liver because of the reasons that they because of the oxidative stress they're going through. We're definitely gonna talk about that, how obesity is leading to different problems in your liver or in your heart or in your blood vessels. So and obviously people need to have more omega-3 fatty acids in their diet, just like I discussed, like more proteins, less carbohydrates, and a certain portion of fats also needs to be taken. You can't eliminate fat, because fat is really essential for making hormones in your body, right? So you need to have good fats as well.
I
So
get it.
that's kind of a later discussion we're gonna have.
Definitely.
Yeah. So do you know how this obesity leads to cardiovascular diseases?
Could it be just fat tissue surrounding the heart?
That's how it starts, But once you have like bad fats in your blood, like bad cholesterol in your blood or dead blood cells, they start to accumulate. So here you can see that the spilled lipids, when they go into the bloodstream, they start to accumulate. They start to store up different collagen, because everything is flowing through that or arteries. It's like a tube, If something is blocked, definitely the blood flow will be blocked. So once the fat molecules, they start to accumulate into the blood vessels, they oxidize and they attract macrophages. These are like the
Immune cells?
These are the immune cells. So they attract, the body cell sends signal to the brain, oops, there is some blockage coming up. So the brain sends its forces in the forms of macrophages to clean up that area. Okay?
But that then, doesn't this cause more inflammation?
Actually, inflammation is a protective mechanism.
Mm.
But but body doesn't know how to do it except this mechanism. Right? So it's the forces that it sends in the form of macrophages. It comes up to clean up that area. They're like the cleaning ladies of the blood vessels, right? But the problem is they cannot take it out. So they just stop it there. But the inflammation starts to to flourish in that area. So that's how the blood vessels become clogged, and then that clogged fat, that accumulated fat in the blood vessels, it blocks the arteries, and then if it gets dislodged and starts moving inside the blood vessels with the blood flow, it can go to smaller arteries, and once it goes to smaller one, it can block the blood flow, and that's how people start having stroke.
Oh, I see.
Yeah, it's a whole mechanism, but it all starts from obesity. That's the problem.
Wow.
Yeah. So
That's so interesting.
yeah. You need to, people need to understand this. That's why we are here to educate. People should educate themselves that how this whole process is starting up. Do you think that this can lead to affect the liver as well?
Yes, definitely. It definitely is the fatty liver.
Yeah, true. And how do you think that this adds up to, the obesity adds up to fatty liver?
That I'm not quite sure. I think you need to enlighten me.
Okay, basically there are two types of cholesterols in the blood. If the type of fat that you consume matters a lot. And not only just fat, the carbohydrates as well, because anything that is not good in the body, that needs to be detoxified by the liver. And it's like a cleaning machine in your body. So if you are putting bad stuff in your body, your liver is going to affect anyways. So if the bad kind of food that you're taking in, bad type of cholesterol, it gets into the bloodstream, the liver captures it and tries to break it down, in simple words, tries to metabolize it, tries to break it down into different metabolites, and try to excrete it outside the body through urination and feces and poop it in the washroom. Yeah. But then if we talk about cholesterol, the type of fat, there are like 80% is synthesized in the liver. So like 80% is already processed in the liver, and only 20% is taken inside the food, with the food. So what do you think that does the cholesterol is important in the body?
Oh
Do you think
yes, cholesterol is definitely important in the body.
How do you think that?
That I'm not too sure too.
It's okay. Yes, because all of your hormones are made from cholesterol. It's so important, and the body works on hormones, for male and female both. And cholesterol is like a protective coating around our nerves as well. So all of the electrical system inside the body is like, the insulation provided is by the cholesterol. So this is how much important it is. But the problem is the liver is so innocent enough to process everything inside it, whether it's cholesterol, whether you're taking excess sugars, whether you're taking less protein. The innocent liver has to process it all. Yeah. So the next slide I'm going to show you is how the healthy liver turns into a bad liver, actually. So this is so common these days that because the liver is concealed inside the body, people don't even realize that they have started to have a fatty liver, right? So once you start to have obesity, there are so many metabolic disorders that happens, and it leads to either alcoholic or non-alcoholic fatty liver.
Yeah.
Right, so once it starts to accumulate fat, lots of inflammation starts to happen inside, like lots of interleukins, inflammatory markers, they accumulate, they add up, and as you can see, the nodules, these nodules, yeah, these nodules, these are the like the superficial. When you do the ultrasound, we can clearly see it. Like, this is very visible on the ultrasound.
Is that the fat accumulation?
Yes, this is the fat accumulation, right? So this is the one of the visible signs you see on the ultrasound, right? But sometimes this is not visible. Like, this happens in the later stages. So we're going to share you a very interesting case that how this one of our patient, she was going through the same process, but we were able to reverse the whole fibrosis.
Yes, so
and fatty liver.
maybe we'll talk about just liver fibrosis, fatty liver, what we have for her first.
Yeah, at Scientist Home, we treated one of our patient who was suffering from obesity and severe fatty liver, and all the process that we showed you in the previous slide is actually she was going through that, and she was lucky enough to reverse it.
Yeah, and because of her fatty liver, it actually turned into hepatitis B.
Yeah. She actually gained another infection because of the fatty liver and the fibrosis that she was having. She got a super infection because her liver got weak. So once the liver got weak, the immunity system was weak, and she got infection of hepatitis B and C. Yeah.
So at Scientist Homes, we actually all our supplements are great food nutritional supplements. So there's no Western medicine, there's no side effects, so you don't have to worry about any of that. Just send in your pictures and a brief description of what you have, and then us, the nutritionist and wellness team, will get back to you as soon as possible with the best combination for your situation.
Yeah, definitely. Actually, you can WhatsApp us. Do you know how easy it is to contact us? You can just WhatsApp us or call us with your reports, your signs and symptoms, whatever issues you have, and definitely we're gonna get you back with your health issue, and we'll follow up with the best possible combination from the Scientist Home.
Yes. So with this,
are you ready for the amazing case that we want to discuss today?
So we have a 42-year-old lady. She's 156 centimeters and 70 kilograms. BMI 29.
Actually, the BMI that she had was a borderline obese. Yes, she was overweight.
Yes.
Although she was like a borderline obese, but her signs and symptoms were pretty bad. And this condition was there for quite a long time. So that's why the body was accumulating fat around the liver, and she went into the state that we're going to explain now. So this is one of the she sent her lab reports from the clinic that she got them done. So as you can see that her ALT, AST, ALP, and GGT, these are the liver enzymes she had. So they were in the normal range, pretty much normal range. Yeah, and by the way, just a disclaimer that we are showing these with the permission of the patient, and that's why we have concealed the names and ID for privacy reasons, right? So her liver enzymes were in the normal range, right? So that's like not a red flag right now, right? But once we checked her diabetic profile, as you can see that her fasting glucose was 6.1, which is actually a borderline pre-diabetic. Yeah, it should be like less than 7, but her fasting glucose was pretty high. It shouldn't be like more than 5.9, right? So her HbA1c, which is a marker that you had more sugar in the past 6 months, like you had a spikes of sugar in the past 6 months, so that was also high. So her diabetic profile was, she lied into the category of pre-diabetic, so that put her on a risk for becoming diabetic, having a diabetic mellitus type 2 disease. So this is one of the lipid profiles she had. So her total cholesterol was normal, but her triglyceride level was way higher. That is 2.3, and mind
Nearly
you,
double.
Yeah, nearly double.
Nearly double.
So it's you know, one of the risk factors that if you have triglycerides, and in medicine, it's triglyceride is like even if you have lots of sugary drinks or sugary stuff, lots of carbohydrates, the triglycerides shoots up, and the body doesn't know how to store the triglycerides, so it stores it into the form of fat cells. So this is one of the reasons, you know, our patient was at higher risk of having liver fibrosis and fatty liver. And these were the liver function tests, the renal function tests. These were also in the normal range.
Yes.
Yeah. So as you can see, even the blood tests, they were normal, but her lipid profile was triggering enough
Yes.
to show us that she was prone to fatty liver. So one of the doctors advised her to go for FibroScan.
Yes.
And her FibroScan, it showed that her value was 329. Like it's a lot. It's a lot. The normal range has to be in around like below 200, and it was, her cap value was, yeah.
It should be 11.
It was, no, it
The
should be like,
range.
yeah, exactly. So it was 329. It had shooted a lot, and her LSM value, which is like how much fat stored inside, was also 7.9, which is supposed to be less than 7. So these two values were enough for us to, you know, put her into a regimen to reverse the process, right? And in the next slide, you see that the doctors had labeled her as borderline obese and called her that she has pre-diabetic, and then labeled her as having dyslipidemia, having like, you know, different ratios, a higher ratio of bad cholesterol in the body, right? So on her ultrasound, she was labeled as having moderately increased fatty liver, right? So all of these findings were, you know, and these pictures that you see now, these are the ultrasound pictures that you see. The hypoechogenicity of these are clearly showing that how much fatty liver she had. Although her tumor markers, there were no tumor markers, they were in the normal range. So that's how we came to know that, you know, right now at this stage, she is not having any cancerous tissue inside the liver, but definitely she is prone to have, you know, in the later stages, if it progresses with the same speed, she will have hepatocellular carcinoma, like cancer, maybe in 1 or 2 months. You know, who never knows? And you know, that's the best thing. When she came to us, this is what our co-founder, Chancellor, advised her to have the combination of different products. Yeah. Would you enlighten us with this?
Yes, so this is a Lipoli study.
lipolystudy,
lipolystudy, and also
colipolysis, colic acid.
yes, these two are for fatty lipids. And then on top of that, what we have is we have the high concentration proteinase, and also the high concentration
Matrine propolis.
matrine propolis.
Yes.
Yes.
So this combination, or for just a month, it was just a trial, you know.
Mhm.
And what do you think that how much this must have cost her?
Maybe
Just this 1 month.
10,000.
Yeah, around like 6 to 8,000 Hong Kong dollars.
For something that's
Irreversible.
irreversible. This is a small price to pay, I think.
Yes, definitely.
I think.
Because you're reversing the whole process, which is leading you into, you know, which is pushing you into cancer state. You're just, you know, you're trying to reverse the process and tackling with the whole situation right in the start of the process. Yeah. So I think this is a very small price to pay, which is around like $1,000 US, right? For a month. Yeah. Because if the situation goes really bad, lots of medications, lots of, you know, doctors can prescribe lots of medications, and once you start taking those, it's like a never-ending cycle. You take a medication, and then you start taking another medication to just alleviate the side effects of the first medication.
Yes.
So it's better to nip the evil in the bud, you know.
Yes. So should we talk about the lipoly study?
Oh yes, definitely. We would like to, you know, discuss all of these in detail, that how these help you in reversing the whole fatty liver and liver fibrosis, because our customer or patient was going through the same fatty liver and liver fibrosis.
What am I looking at?
Yeah.
So the lipoly study, it breaks down stored fats into glycerol and increases calories consumption by the body.
Yeah. Actually, you know, do you know that the hunger in our body is actually controlled by two hormones, which is ghrelin and leptin. So ghrelin is like an appetite hormone, which increases. Once that appetite hormone increases, we start to feel hunger. And then there's another hormone, which is called leptin, which is like a satiating hormone. When that increases in our body, we feel like, oh, start to feeling full. We don't need to eat much. So with this R&D of lipoly study, we have, like, it's a breakthrough that we have now finally know how to regulate this appetite and satiated hormone. So this is going to, you know, decrease the insulin resistance in the body and also decrease the adipose tissues, the fat cells. So this lipoly study is a research-based supplement and totally natural to, you know, to regulate that mechanism. Yeah.
So what about
this one, the colipolysis colic acid?
Yes.
This reduces the liver lipid level, and also decreases the inflammation and promotes hepatic regeneration. You know, in simple words, I can say that it increases the liver repairing process, which is very crucial for the regeneration of the liver, you know. So, and it also regulates the bile acid. You know, once we take the fats in our body, once you take a very fatty or heavy meal, so the liver secretes bile acid into the gallbladder. So it stores into it, and then the gallbladder releases that bile acid into the intestines to mix it into the food, so that the fat molecules can be broken down and absorb into the body. So this colipolysis colic acid research study is actually is going to help in the digestion process. So it's basically a helper for the liver to process the fats.
And also promotes fat and cholesterol metabolism.
Yes,
as well.
through the bile acid that I just just explained, and once the bile and the cholesterol metabolism is controlled, it reduces the fat tissues and improves the fibrotic process that is going into the body. So it reduces the fibrogenesis and improves the liver function. So these two products, the lipolysis study and the colipolysis cholic acid study, these two combined together, they reduces the oxidative stress. The oxidation, when that happen, it reduces that. So in the next one,
the
metrine propolis. Yes. So this reduces the this also reduces.
So this one kills and inhibits bacteria and viruses, and also reduces pain and inflammation and protects the stomach lining.
Yes, absolutely, because this is going to decrease the inflammation, and this will cause the inflammatory markers, the CRP, which we see in the blood tests. When you go to a doctor, they prescribe you like ESR, CRP, lot of blood tests. The blood tests are basically the inflammatory markers that we see on the paper that that inflammation is going really high in the body. So this metrine propolis is going to reduce that. It's going to reduce the adhesion of bacteria and viruses on the cells. So once that adhesion is stopped, so the process is reversed, because our patient was suffering from hepatitis B and C, right? So from the infection of that hepatitis was significantly reduced by using this metrine propolis.
I see. And also the last one.
We also prescribed the iron chelation study. So actually, how do you think that this helps in doing so?
This binds to excess, allowing body to release
into
urine and feces.
Yes, it does.
Does it bind to extra fats?
It actually binds to extra iron and heavy metals in the body. So because we're consuming so many pesticides, these days, through food, and so many chemicals these days, because nothing is pure. So, and especially your junk food as well. So if you're consuming anything like that, so it just binds to that, it chelates it. That's a very scientific term to use, to chelate it, but that's actually, in simple words, it binds to the excess heavy metals and excess iron and takes it out through urination and feces. So this product is one of the breakthrough research, and which is very natural, and it's
no side effects.
With no side effects.
Yeah.
So this is one of the reasons that our patient was able to reverse the whole liver fibrosis. Yeah. And the next product that was prescribed by our founder Chenser was this
high concentration proteinase.
Yes.
Yes.
How do you think that this helps?
And so this degrades cytokines and disintegrates fibrosis-related factor proteins.
Yes, actually, it blocks the proteinase-activated receptors. All of the cells in our body, they have different kind of proteinase-activated receptors. So this research, this supplement is going to act on those receptors and reduce the production of fat cells. And once that is reduced, the inflammation will automatically gone, right? And also the amino acid, the fibrosis that starts to help, the fibrosis is reversed by acting on different amino acids. Yeah. So let's come to the actual results.
The interesting part.
Yes. So this is a graph that actually shows that how significantly and how quickly our patient reduced 9.5 kilograms in just 3 months.
Just using these two products.
Yeah, just 3 months. Her starting weight was around 71 kgs, right? And she reduced to around 61 kgs in just 3 months. How amazing is that, right?
Amazing.
Yeah, and this is the BMI, like before starting.
She was
Back in
obese.
July. Yeah, back in July, she lied. She was in the category of borderline obese, and just after 3 months, in this October, she was able to reach her normal weight, which is amazing. It's breakthrough.
And it's all just natural supplements.
Just natural supplements and
No,
no side
Western
effects.
Western medicine, no
Side
side
effects.
effects.
So this is the graph that shows the liver stiffness measurement, the one that we showed you previously, that her value was in around 7.9. So this green box is basically the normal range. So she was able to come into the normal range very quickly and reversing her cirrhosis. So her cirrhosis, her fibrotic tissue was reversed, and this is and her CAP values, like the fat stored into the liver, was also significantly reduced in just 3 months.
Wow.
Yeah. So
Just
this is
3
this
months.
this is this fibroscan afterwards. So you can see like from 7.9 to 5.8, and then from 329 to 275. This is amazing. This is
Wow.
Miracle.
that's
This is like a miracle.
For something
irreversible.
irreversible,
It's
it's reversed.
Yes. So at Scientist Home Supplementation, you will definitely have these amazing results. So this is just one criteria. This is just one case that you see, but we have so many other cases.
Yes, that we will be definitely doing a lot more of these live broadcasts and sharing and sharing with you guys all our
case
studies and talking about what our product combinations can help with these
with your health issues.
your health issues.
Yes, and not only these supplements, but you need to have, look, whatever supplements you take in your life, you need to change the lifestyle, you know, just to add up, to increase the recovery period. You need to, you know, there are few things, like, would you like to highlight on that, Miss Chan?
I would think you not to eat too much.
Yeah,
not too
definitely.
full. Maybe eat around 70% full.
Yeah, because in stomach, they're like in one of the very holistic medicine, it said that, you know, you should have 1 portion for food, 1 portion for water, and 1 portion for air, so that your stomach can work in a proper way.
And then avoid high estrogen foods.
Avoid high estrogen
such
foods,
as like chicken skin,
chicken wings, fried food.
Yes, milk.
Yeah, I mean, milk in moderation is fine, but if you think that you have lactose intolerance, then you definitely need to avoid.
Yeah. And also drink more water. I think that's one thing that Hong Kong people definitely need to do a lot more of.
That was actually really surprising for me to see that, you know, water is easily available in Hong Kong, because when I was practicing back in Saudi Arabia and Pakistan, water was not easily available. Like, you had to buy, but it's like free here, so you should drink a lot of water, and take as many steps as you can. Take a stroll. If you're working in your office, you have a lot of sitting day, take a little stroll in your lunch break, or maybe just between the work. After every hour, go to the fountain, fill up your water bottle, come back, have a little stretch, you know, take some time, and then this definitely is going to add up with whatever supplements or combinations that Scientist Home provides you with. Yeah. And we will definitely come back to you with a lot of other interesting cases that, like, in my practice, I've never seen before. But here, with a lot of natural supplements, we are going to discuss them with you. We're going to share them with you. So if you think that, you know, you are suffering from any health issue, or you're having any problems, you can send
You're
your report.
welcome to contact us, send us your report, send us anything, and we will be in contact shortly.
Yes, we'll reply you promptly, and we'll get back to you with your reports, what kind of problem you have, and definitely we're going to suggest you with the best possible combination that we can offer.
Thank you for listening to our talk today.
It was great. I hope that this educational video was just a teeny tiny solution for your problem, or maybe you could relate to it, or maybe you have understood some of it. So
please, if there's any constructive criticism or anything like that, please leave it in the comments below. We'll definitely read it, and we'll definitely try and become better at this as we go along.
Yeah.
So yes, thank you for watching our live.
Yes, and we will see you next time.
We'll see you
with
next time.
Next interesting case.
Yes.
And how we were able to reverse the health issue.
Yes.
See you next time.
My name is Madam Chan.
And my name is Madam Elaine. See you next time on Scientist Home live broadcast. Bye-bye.
Bye.